Hello there, and welcome to Fix Your Smile. I want to have a little chat with you today, one that's incredibly important for your overall health, but often gets pushed to the bottom of the to-do list. We are going to talk about your teeth and your gums. We're going to uncover a little secret that isn't really a secret, something dentists wish everyone truly understood. It's all about that 6-month visit to the dental hygienist for a proper scaling and polishing. It sounds simple, and it is, but its power to protect your smile and your health is truly massive. Think of it like getting your car serviced. You don't wait for the engine to start smoking on the motorway before you take it to the garage, do you? Your mouth deserves exactly the same kind of preventative care. That regular clean is your mouth's essential service. It's a chance for a professional to get into all the nooks and crannies that your toothbrush, no matter how well you use it, simply cannot reach. So, why every 6 months? It seems quite specific, doesn't it? Well, there's some very good science behind that number. It takes about 3 to 6 months for the bacteria in your mouth to grow into colonies that are strong enough to start causing real trouble, like gum disease. By scheduling a professional clean twice a year, we are essentially hitting the reset button. Let's demystify these two words, scaling and polishing. They might sound a bit technical, but the ideas behind them are very simple and straightforward. Let's start with scaling. Imagine you're cleaning the tiles in your bathroom. You might notice some hard, crusty buildup in the corners or between the tiles that a simple wipe won't remove. This is called limescale. A very similar thing happens in your mouth. A sticky film of bacteria called plaque is always forming on your teeth. If it's not brushed away properly, it hardens into a substance called tartar or calculus. Your toothbrush at home cannot remove this tartar, no matter how hard you scrub. That's where scaling comes in. A dentist or hygienist uses special tools to gently scrape away this hardened tartar from the surface of your teeth and just below the gum line. One of the main tools is an ultrasonic scaler. It uses gentle vibrations and a little spray of water to break up the larger pieces of tartar. It feels a bit like a tiny power washer for your teeth. Once the scaling is done and all the rough, hard tartar has been removed, it's time for the second step, polishing. If scaling is about removing the bad stuff, polishing is about making everything smooth and shiny again. The hygienist will use a small, soft rubber cup that spins around. A special, slightly gritty paste, which is a bit like a very fine exfoliant for your teeth, is put in the cup. The process buffs away any remaining minor stains and makes the tooth surfaces incredibly smooth. A smoother tooth surface makes it much harder for plaque to get a foothold in the future. So, in short, scaling removes the hard-to-reach gunk, and polishing makes your teeth smooth to help keep them clean. It's a perfect two-step process for a healthy mouth. So, you've had your teeth scaled and polished. What are the actual benefits you walk away with? There are quite a few, and they go far beyond just having clean teeth. The most important benefit is the prevention of gum disease. Gum disease, or gingivitis in its early stages, is caused by the plaque and tartar that build up along your gum line. This buildup irritates your gums, making them red, swollen, and likely to bleed when you brush. Regular scaling removes the cause of this irritation, keeping your gums healthy and pink. Another fantastic benefit is fresher breath. Persistent bad breath, which we sometimes call halitosis, is often caused by the bacteria that live in the plaque and tartar in your mouth. These bacteria release smelly sulfur compounds as they feed on tiny food particles left behind after you eat. You can use mouthwash and mints, but they only mask the odor for a short time. A professional clean physically removes the vast majority of this bacteria and the tartar they call home. This gives you genuinely fresher breath that lasts, because the cause of the smell has been taken away. Let's not forget the cosmetic benefits either. While scaling and polishing is a health procedure, it also gives your smile a mini makeover. Many of the things we enjoy every day, like coffee, tea, red wine, and certain foods, can leave stains on our teeth over time. The polishing part of your dental clean is brilliant at removing these external stains. The gritty paste gently buffs them away, revealing the natural brightness of your teeth underneath. Finally, a regular cleaning appointment is also a fantastic opportunity for early detection of other problems. While the hygienist is cleaning your teeth, they are also having a really good look around your mouth. They can spot the very early signs of cavities, which are much easier and cheaper to fix when they are small. Catching these things early can make a huge difference to the treatment required and the final outcome. It's a health checkup for your entire mouth. There are a lot of myths and misunderstandings floating around when it comes to dental cleanings. These myths can stop people from getting care they need. Let's tackle a few common ones. The biggest myth: I brush and floss perfectly. so I don't need a professional clean. Home care is essential, but not enough on its own. No matter how diligent you are, some spots are hard to reach. Right at the back, just under the gum line. Your toothbrush bristles can't get into every tiny crevice. Over time, plaque is missed in those spots. Once plaque hardens into tartar, you can't remove it with a toothbrush or floss. Only the special tools a dentist or hygienist uses can get it off. See home care and professional cleanings as a team. They work together. Brushing and flossing do the daily maintenance, while a professional clean does the deep, essential service. Myth: scaling damages enamel. That's false. Professionals are trained and tools are designed to remove tartar safely. Some sensitivity after a clean isn't thinning enamel. It's exposed root after tartar comes off, and it's temporary. Myth: no pain equals no problem. That's dangerous. Gum disease and early decay are often painless. You can have serious issues without feeling anything. Bleeding gums are often the first sign, but people ignore it. If you wait for pain, problems are more advanced and costlier. Regular checkups find issues early. Don't wait for pain to be your guide. Prevention is always better than treatment. So, what are the real-world consequences of regularly skipping your 6-month cleaning appointments? Well, it's not just about missing out on the benefits. It's about what actively starts to go wrong in your mouth. The process is gradual, which is why, honestly, people often don't notice it happening until it's a significant problem. The very first thing that happens is that the plaque you miss with your toothbrush gets a chance to sit undisturbed. Within just 24 to 48 hours, this soft plaque begins to harden by absorbing minerals from your saliva. This is the beginning of tartar formation. Now, this tartar is rough and porous, making it a perfect surface for even more plaque to stick to. This creates a vicious cycle. The tartar builds up, which attracts more plaque, which then hardens into more tartar. At first, you might just notice your teeth don't feel as smooth or look as bright. Then you will likely start to see a visible yellow crust or a brownish crust forming, especially on the inside of your lower front teeth. This is tartar, and it is now a permanent fixture until it is professionally removed. It acts as a constant source of irritation for your gums, which are in direct contact with it all day, every day. This constant irritation leads directly to the first stage of gum disease, gingivitis. Your gums will become inflamed. They will look red and puffy instead of pale, pink and firm. The most common sign that people notice is that their gums start to bleed when they brush or bleed when they eat something hard like an apple. This is your body's alarm bell, telling you that something is wrong. Unfortunately, many people either ignore this or think they are brushing too hard and start brushing more gently, which actually makes the problem worse. If gingivitis is not treated by removing the tartar, it can advance to a much more serious stage. If left unchecked, the inflammation will progress to periodontitis. The inflammation starts to affect the bone and ligaments that hold your teeth in your jaw. Your gums may start to pull away from your teeth, creating little pockets. These pockets then get filled with more plaque and tartar, making them deeper and deeper. The bone that supports the teeth gets slowly eaten away by the chronic inflammation. Eventually, the teeth can become loose and may even need to be extracted. All of this starts from simply not removing the tartar that builds up over time. It's a slow but destructive process. As a dentist, I see the direct results of both diligent care and long-term neglect every single day. The contrast between a patient who comes in every 6 months and one who hasn't been for 5 years is truly striking. Let me share a couple of typical scenarios. A common one is the young professional, perhaps in their late 20s or early 30s. They were good about seeing a dentist as a teenager, but then life got busy with university, starting a career, moving to a new city. The regular 6-month visits just fell by the wayside. They don't have any pain, so they assume everything is fine. When they finally come in, often because a partner or friend has commented on their bad breath or they've noticed their gums bleeding, we have a look. What we usually find is a significant amount of tartar built up behind their lower front teeth and in between their back molars. Their gums are bright red and bleed at the slightest touch from our dental mirror. They have classic gingivitis. The cleaning appointment takes much longer than usual because there is so much hard deposit to remove. Afterwards, their gums will be sore for a few days as they start to heal. The good news is, at this stage, the damage is usually reversible with a good clean and improved home care. A more concerning story is that of a patient in their 40s or 50s who has skipped cleanings for a decade or more. They might come in because a tooth has started to feel a bit wobbly, or they have a persistent bad taste in their mouth. When we examine them, we often find advanced periodontitis. The tartar buildup is extensive, going deep down below the gum line. We use a special probe to measure the pockets around the teeth and find they are very deep, indicating that significant bone loss has already occurred. X-rays will then confirm this, showing that the bone levels supporting the teeth have dropped. The treatment at this stage is much more involved. It requires multiple appointments for deep cleaning, sometimes called root planing, often done under local anesthetic. In some cases, referral to a specialist periodontist is needed for surgical treatment. Even with all this effort, we may not be able to save all the teeth. The patient is often shocked to learn that they are at risk of losing teeth, especially since they never had a toothache. It's a difficult conversation to have, and it's heartbreaking because we know that this entire situation could have been prevented with simple, regular 6-month cleanings. For a long time, we used to think of oral health as being separate from the rest of the body. The mouth was seen as its own little system. But over the last couple of decades, a huge amount of research has shown us just how wrong that view was. We now know, without a doubt, that the health of your mouth is deeply connected to your overall health. The mouth is a gateway to the rest of the body, and problems that start there can have far-reaching consequences. This makes your regular dental cleaning even more important. It's not just about preventing tooth loss, it's about protecting your general well-being. The main link between oral health and general health is inflammation. The chronic inflammation that is present with gum disease doesn't just stay in your mouth. The bacteria from your infected gums can get into your bloodstream. Your body's immune system responds to this with a widespread inflammatory reaction. This low-grade, body-wide inflammation is now thought to be a contributing factor in many serious health conditions. One of the most well-established links is between gum disease and heart disease. Multiple studies have shown that people with periodontitis are at a higher risk of developing cardiovascular problems, such as heart attacks and strokes. The theory is that the inflammation from the gums can contribute to the process of atherosclerosis, which is the narrowing of the arteries. The bacteria themselves have even been found in the fatty plaques that clog up blood vessels. While it's not a direct cause and effect relationship, the association is strong and recognized by both doctors and dentists. Keeping your gums healthy is a heart-smart move. The connections don't stop there. Gum disease has also been linked to difficulties in controlling blood sugar levels in people with diabetes. It's a two-way street. Diabetes makes you more susceptible to gum disease, and active gum disease can make it harder to manage your diabetes. There are also links between poor oral health and respiratory infections like pneumonia, especially in older adults, as bacteria from the mouth can be inhaled into the lungs. There is even emerging research looking at connections to conditions like rheumatoid arthritis and certain types of cancer. The message is clear. Looking after your mouth is a key part of looking after your whole body. We know that for many people, visiting the dentist can be a source of anxiety. The sounds, the smells, the feeling of vulnerability in the chair, it can all be a bit overwhelming, and sometimes the cost can be a concern too. But it's so important not to let these barriers prevent you from getting the essential care you need. The most important thing you can do is communicate with us. If you are feeling anxious, please tell us. We are not here to judge you, we are here to help you. If anxiety is your main barrier, there are many things we can do to make your experience more comfortable. If cost is a concern, it's worth looking at your options. Many dental practices offer payment plans that allow you to spread the cost of treatment over several months. The cost of a routine cleaning is very small compared to the cost of complex treatments like root canals, crowns, and dental implants, which are often the result of neglecting preventative care. Your 6-month professional cleaning is your secret weapon for long-term oral health, but the daily battles are won at home in your own bathroom. The work you do every day is the foundation of a healthy mouth. Brush your teeth twice a day for 2 full minutes each time. Use a fluoride toothpaste. Fluoride strengthens enamel and helps prevent cavities. Don't press too hard. Use gentle, circular motions. Brushing can't clean everywhere. Spaces between teeth are a prime spot for plaque and where gum problems can start. Clean between your teeth every day. Traditional dental floss, interdental brushes, or water flossers. Find a method you like and will stick with. Think about your diet. Sugary foods and drinks feed decay-causing bacteria. Limit sugary treats to mealtimes. Drink plenty of water. Don't forget your tongue. Clean it by brushing gently or using a tongue scraper. Combine these home habits with your 6-month professional cleanings, and you give yourself the best chance of a healthy, happy smile for life. Your smile is worth it. Thank you, and don't forget to smile, like, share, and subscribe.